Hello. The symptoms your doctor does not know are fibromyalgia. I'm Sharon. She's Ginevra. Last week we discussed the hallmark symptoms of fibromyalgia. Today we are discussing Fibro's frustrating fiasco, a long list of troublesome symptoms.
That's the perfect way to describe it. And we've actually gotten a lot of requests to talk about these kind of secondary or less commonly spoken about symptoms. So last episode, we talked about the primary symptoms of fibro. Link in the description below if you want to watch that episode. For today, we're going to go ahead and move on to what I call kind of secondary symptoms of fibro. And I want to first put the caveat out there that this is the way that I interpret the medical literature, and based on kind of my experience as a fibromyalgia specialist. But fibromyalgia is varied. Humans are different, and not everybody's going to experience every symptom. And there's absolutely going to be symptoms that I don't talk about today that are still really important. So I don't want anybody to feel neglected. I was just trying to kind of do a 30,000-foot view. What are those primary symptoms that are kind of less commonly talked about?
And that is why fibromyalgia is so complex and complicated and difficult to treat, is for that reason. There's all of these symptoms. We all have different ones, and we respond differently to the treatments.
And we're lucky if our doctors know about like the primary hallmark symptoms of fibromyalgia, let alone like some of the more obscure ones. And I think this is where, and part of why we're kind of doing this video, is to make sure that people really kind of for themselves understand what is kind of their typical fibro symptoms, and then what is maybe different and you need to get evaluated. So the way I put this together is I think of it as kind of two categories. So there's definitely some other conditions, some standalone syndromes that people without fibromyalgia can have. For example, irritable bowel syndrome. People without fibro have that, but a lot of people with fibro have it. Not everybody, but almost like 70 to 80%. So pretty darn common. So I kind of separate it into symptoms or groups of symptoms that tend to accompany fibromyalgia, and then more kind of the not related to any particular other illness or syndrome, those kind of orphan symptoms. So like nausea or dry eyes or rash. So first I'm going to go through some of those other standalone conditions, and then I'll move into the kind of symptoms that don't belong to any other syndrome. And again, even within this part, I had to make some, decisions as far as like what could I cover and what I couldn't, just in the interest of time, and also to not muddy the waters too much. But broadly, the things I'm not talking about right now are all the autoimmune diseases. So lupus, rheumatoid arthritis, Sjogren's, those are all more common in fibromyalgia and absolutely accompany fibromyalgia for a certain portion of folks. So I'm not going to dive into those so much. And I'm also not going to talk about those more kind of post-infectious, like post-viral, or maybe like Lyme disease, those kind of other things that kind of accompany or even maybe trigger fibro. And I'm really doing that just so it's a bit clearer in our heads, because if doctors can't really understand fibro, we have to be able to understand it ourselves. And so I wanted to just kind of give you this structure to hang your hat on, so to speak. But again, I'm definitely going to miss things, and this is just the way I, Dr. Ginevra, put it together. So Raynaud syndrome, that's super common, and it's vasospasm. So basically certain of your blood vessels constrict, usually in response to things like cold, and the tissue will get white and then blue, and then blood flow will come back, and it can be really painful. Migraines are also super common in fibromyalgia. Irritable bladder syndrome, also called overactive bladder. So frequency with urination, kind of a sense of urgency, having to wake up at night to go to the bathroom. Vulvodynia is actually pretty common in fibromyalgia, and it's actually something I experienced earlier in my career with fibromyalgia, and so we'll definitely talk about that. I mean, all of these kinda can have their own separate episodes, but vulvodynia is really, um, kind of pain, stinging, burning, stabbing type pain, and pain with, intercourse. And then irritable bowel syndrome. So I liken this to a car that the transmission's not working right. So sometimes it's going too fast, sometimes it's going too slow, and it's kind of like not able to get into gear. That's kind of what our bowels are doing in irritable bowel syndrome. And this again, super common in fibro and can actually be pretty painful. You can have a lot of abdominal pain or even like rectal pain, pain with bowel movements, that kind of thing.
Yeah, and we even had one viewer and another comment in a different forum talking about how they actually need to like rest after a bowel movement because of the pain and maybe even use a heating pad on the stomach for that reason.
Yeah, and I will say that, in its more severe cases, absolutely, IBS can have that. Now, the challenge is there's lots of other things that can do that you do really need to get checked out, and you do need to get a colonoscopy and make sure it's not like, you know, colon cancer. Irritable bowel syndrome is really diagnosed when we know that there's nothing else going on that's causing those symptoms in the GI system. And then POTS, which is postural orthostatic tachycardia syndrome, that is a mouthful, which is why we just call it POTS. And basically, it means when you go from sitting to standing, your blood pressure drops, heart rate goes up, and you might experience dizziness, fatigue, even like passing out. This is something that my teenage son, deals with, and I can tell you it can be a beast. He doesn't have fibromyalgia, but this on its own can be cause a lot of impairment. And then joint hypermobility, which is kind of on a spectrum with the more severe being represented by Ehlers-Danlos syndrome or EDS. And again, this could be actually multiple episodes, but a lot of people with fibromyalgia have joints that are more flexible than normal. And that can cause problems because the muscles and the tissue around that joint work harder to stabilize it. And the last thing we need in fibromyalgia is muscles that are working harder. Go back to last week's episode if you want to learn more about why our muscles are struggling so much in fibro. But this again is on a spectrum. So there can be just really mild joint hypermobility that doesn't cause people a lot of problems, all the way to like really severe Ehlers-Danlos syndrome that causes a lot of symptoms. And then there's a few other standalone conditions that are pretty common that often accompany fibromyalgia. Tinnitus, also pronounced tinnitus, both are accepted. Actually, both are acceptable terms. I think tinnitus sounds a little bit better. I will say that I have this, and it's gotten worse in the past couple years, and it sucks.
It does.
I have to have like not just one white noise. I have to have like multiple white noise machines going at night to like get all the different like weird frequencies. Um,
Oh,
so yeah,
interesting. Yeah.
it can be a beast.
And I've noticed that on the apps that have like a lot of great free apps out there that we talk about all the time on the show, have ones that are specifically designed for tinnitus. There's
Oh,
like tinnitus like frequencies, and I've tried them because I have it too, and it actually is very soothing. Yeah.
I'll have to check that out. All right. And then also insomnia, anxiety, depression. I always want to just say fibromyalgia is not caused by depression, but certainly having fibromyalgia can cause depression. Lots of people deal with depression and anxiety, insomnia that don't have fibromyalgia, but they tend to just be more commonly seen in patients with fibro. And unfortunately, this is where some doctors sort of, at least in the I don't know, early days, kind of lumped the fibro symptoms into sort of like, oh, it's just in their head. That's just like women that are dealing with depression. And I can solidly say that they are two separate things that often coexist. Okay. So we've kind of gone through 30,000-foot view of a lot of the common standalone symptoms or syndromes that occur with fibro. What we've not talked about are some of those common comorbid pain conditions. So, like TMJ or pelvic pain, or I think, Sharon, you were saying there's like
There's 10,
10.
10 chronic overlapping pain conditions or COPCs, and we're gonna talk about this more in upcoming episodes. We'll probably do a whole episode just on having the 10 together because I think it's important. A lot of people don't understand this overlap and this interrelationship. And on the plus side of things, some of these conditions have treatments, and when you treat one thing, often others also feel like a benefit from that treatment. So it's really important to understand that there are these other things in the picture. I have yet to meet anybody who doesn't have more than one of these chronic overlapping pain conditions. And
I would
possibly in
agree.
the beginning, it might start that way. But over time, you recognize that maybe some of the symptoms you thought were the fibro is actually one of these other ones, or over time, more can come on board. That's not to say that you're going to get all of these and you need to worry about it. It's just helpful for your treatment to understand that these possibilities are out there because it could help you find treatments that are going to be really valuable to you.
I totally agree. For example, I think there's a lot of folks that are first diagnosed with like TMJ or TMD, temporal mandibular jaw dysfunction. And I think that's kind of the noisiest pain area, so they go to their doctor about that. I'm like, "Okay, I got diagnosed with that." And then, okay, now I got diagnosed with, like, chronic neck pain or, so it can be hard to sort of differentiate, like, well, is it just part of my overall fibromyalgia symptoms, or do I also have this? And it's murky waters, and I think this is where working with pain specialists can be super helpful because they actually really can help you to piece out, because I absolutely say if there is something that is, like, on fire, let's say that you have, like, really bad TMJ pain, and you can get that addressed, maybe you get a night guard or, do myofascial release and ease that pain, it can actually lower your overall fibro symptoms. It's like anything that can kinda lower that pain load can be helpful. So, yeah, we should do a whole episode or a few on those overlapping pain conditions for sure.
Oops, we realize we're going a little long. So stay tuned next week, part 2 of this episode. Until then, please like, subscribe, ring the bell, and we're sending you some fibro love.